you're a woman over 40 that is concerned about pelvic organ prolapse, maybe you've been told that you have this, or you're feeling some of the symptoms of pressure or heaviness in the vaginal area, well, you don't want to miss this video. I want to answer a question that I get asked all the time as a pelvic floor physical therapist. What should I be avoiding if I have prolapse? Should I be walking? Should I be running or jumping? Well, I'm going to answer that today. My name is Dr. Dawn Andalone. I am a pelvic floor specialist, women's health physical therapist, and after helping so many women with a more holistic option to help prolapse symptoms, that pressure, heaviness that you feel in the vaginal area sometimes comes with lower back pain or lower abdominal pain. Your pelvic floor muscles might not be functioning properly, and you could be putting a lot of extra pressure down on the pelvic organs because these muscles aren't working the best way, or you're breath holding, or you're bearing down, and you've created some habits over time that exacerbate your symptoms and make the prolapse worse. Well, I'm going to talk you through what you should be doing and how to decide if running, jumping, and more of those strenuous activities are actually right for you. Now, with a prolapse, it could be a bladder prolapse, uterine prolapse, rectal prolapse, and with the vaginal wall, it starts putting more pressure of those organs against the vaginal wall, and you could actually, in some cases, see a bulge through the vaginal area or rectal area with a prolapse. And many women, this freaks them out, scares them, but don't worry. There are things that can help you without necessarily going down the surgical path and getting surgery right away. And I filmed another video on this, what you can do for prolapse without going under the knife. You might want to go back and watch that video as well. But as a general rule, you want to make sure that you're covering those more holistic options. Number one, seeing a pelvic floor physical therapist and consulting with one that is going to give you the right types of exercises. I'm not just talking about Kegel type exercises and tightening and strengthening the pelvic floor. It may be that you do find yourself creating some habits that are making your symptoms worse, and seeing a pelvic floor therapist, they're going to be able to take a lot of history about what your habits are, what your lifestyle is like, what your goals are, and exercises that can help improve this and improve the symptoms that you are getting, in that pressure or heaviness can go away with the right type of therapy. Now, to make that judgment whether or not that you're okay to run or jump or do things that are more strenuous, as a general rule, if in your daily life, if you're just walking around and you're feeling that extra pressure or heaviness or any kind of pain or discomfort, then as a general rule, you don't want to push it and do anything high intensity exercise if you have not already consulted with someone to learn the proper strategies to do it. Now, not to say you're not going to be able to do that stuff in the future. You absolutely will, but you need the right guidance in order to get there. And if you're feeling those symptoms on a general daily basis, if you're doing some housework or at the end of the day, it's not feeling like you have enough support and stability there, then put yourself in the position of doing a lot of jumping and loading through your body. Well, you're going to make your symptoms worse. Now, what can you do, and what would a pelvic floor therapist teach you? Well, they're going to teach you not to breath hold, not to bear down, not to do anything that's putting a lot of strain on your pelvic floor. And one thing could be during, if you're having a bowel movement or feeling constipated a lot, this can also be something that is going to put more pressure down on your pelvic floor. So I use that as a general rule. If you're feeling a lot of those symptoms throughout your daily life and your regular activities, don't push it to do that extra emphasis with high intensity exercise. You can do things instead like swimming or biking or walking, but also working with someone in the right types of exercises to do, or even some lower impact strengthening as well. Now, next, if you are seeing a physical therapist, you have already started that journey. And if you are not then the next step would be to find a program that is going to work on some core exercises with breathing. Mat Pilates is a great way to do this, but you don't want to tighten your abs all the time and just put a lot of pressure on your abdominal wall, because that is going to also put a lot of pressure on your pelvic floor. So make sure that you're following a program that is basic mat Pilates that's going to talk you through breathing exercises along with using your pelvic floor and your core. And there are some great programs online for that. Mine is coming soon with pelvic floor Pilates. But I can honestly say that many women think that they can never do these activities again, like running, jumping, or lifting anything heavy if they have a prolapse. And that is definitely not the case, but you want to learn how to actually activate your muscles, do an exhale and pull in those muscles as you exhale and lift at the same time. Breathing is going to do amazing things for managing the pressure down on your pelvic floor, and breathing exercises are also very helpful. Now, I know this is a case by case scenario, and a lot of women ask me this online. Can I do this exercise, or can I do this with a prolapse? And it really does depend, but I would make sure that you are doing some core exercises and pelvic floor exercises, and best to be guided by a pelvic floor therapist before pushing yourself to do anything that's more strenuous above and beyond what you're doing. Now, if you're already a runner and you know you have prolapse, then think about that area just getting more strain and pressure every time. So it can, over time, exacerbate your symptoms and make it worse. So consulting with a physical therapist who can also guide you in the right direction with what's called a Pessary as another adjunct and another holistic solution that can actually be able to be inserted into the vagina. You can get fitted for this through a doctor. So seeing a gynecologist or urogynecologist, they're going to refer you to get a Pessary. And that also can be something very helpful for women with a prolapse that helps hold things in place and also create less pressure and stress on that area while you're doing something more strenuous. So ideally, the best combination is pelvic floor therapy and a Pessary, and also talking to your doctor about hormones or other avenues if you're in that perimenopause to menopause stage that is going to help the muscle tone through your vaginal wall. So there are a lot of things that can help a prolapse, and I wanted to be able to answer that. I'm sorry I don't have a yes or no answer for everyone. It can depend on your situation, but I would say as a general rule, if you are getting any of those unwanted symptoms when you're walking around your house or doing your daily activities or even your work activities, then definitely don't push it to do extra heavy lifting, running, jumping, exercise above and beyond, but instead try biking, swimming, some mat Pilates, things like that, that are going to help ease some pressure off of your vaginal area and pelvic floor before you push it any further. Now, I hope you found that helpful. A lot of women have questions about a prolapse, and it's important to know all of your options before you jump into surgery. So I wanted to be able to answer that question. If you haven't subscribed already, please do. I love to answer these questions and give you more women's health tips and advice in other videos. So I hope to see you again, and thanks so much for watching.